Bills to regulate medical care provided through telehealth are pending in the Alabama legislature, but debate remains about the proposed rules requiring one in-person visit for every 4 telehealth visits. To find out the difference telehealth has made for patients and medical practices here in the Wiregrass, here again is WDHN's Cody Giles.
With the coronavirus pandemic forcing many people indoors and to social distance, some weren't able to leave their house for an extended period, and that's where telemedicine began making a difference.
Whenever everything was shut down, people were not wanting to get out of the house, but they still needed refills of the medications. They still wanted to discuss issues that were going on in their life. It provided a way to do that.
But now the Alabama legislature is cracking down on the regulations of telemedicine. For instance, patients who need opioids, stimulants, or medicines to treat psychiatric conditions or nerve pain, an in-person appointment was made mandatory. This is supposed to prevent drug abuse, but it may also make it harder for some people to receive treatment, which could be pricey at this time.
People not being as tech savvy as some other patients, if they have poor internet service or poor phone service, that can sometimes cause the calls to not be connected well, but those are typically pretty minor.
Dr. Stokes says without calls from patients via telemedicine, the clinic would have had to close.
A substantial part of 2020 and 2021, close to half of our encounters were done by telemedicine. We wouldn't have been able to stay open had it not been available.
Other organizations have added more ways to do remote checkups, one of which involves hearing a heartbeat from miles away.
A stethoscope that works through Bluetooth, and so what the nurse hears, I hear.
But this still involves someone going out into the home, which could make it easier on patients. Stokes says the number of telemedicine calls he is receiving has dwindled, but there could be more reasons for needing telemedicine in the future.
That has dropped off substantially because people are more willing to get out of the house now. And again, that may change again with gas prices because people may not be able to afford to drive that far for it.
Reporting in Dothan, Cody Giles, WDHN News for the Wiregrass.
Alabama lawmakers have said they want to make sure that telehealth options offer the same quality of care as in-person visits. The bill has passed in the Senate. A vote in the House is next.